안녕하세요. My name is Annabel Eujung Baek, and I am the Chief Plastic Surgery Resident at VCU Health in Richmond, Virginia. Starting in July, I'll be moving to Columbus, Ohio, where I will start a one-year fellowship in microsurgery at The Ohio State University. I had the privilege of meeting Professor J.P. Hong when he was the visiting professor for our plastic surgery division at VCU in 2023. His talks were inspirational, enlightening, and also made me realize how much I was still on the tip of the iceberg when it came to plastic surgery knowledge. When I learned about the International Visiting Scholars Program, I knew I had to take the opportunity to come visit. Although it was for a very short 1 week, it was one of the most invaluable experiences in my residency career. I stayed busy over the 5 days. Morning conference impressed me a lot with the residents presenting complex medical concepts in English and seeing how the professors engaged one another, whether it was on the indications of the surgery or the complications. Although I was with Team A, I also had the chance to attend other morning conferences and learn from the other teams as well. Operatively, it was my first time to see LNVAs and the intricate preoperative mapping using high frequency ultrasound. It was also my first time seeing BioBridge collagen matrix being used. I got to see LVAs in succession with several techniques and see how Team A approaches and designs skip flaps. In the clinic, I was also able to see how ultrasound was utilized so easily to help guide patient education as well as treatment. I learned many lessons and took as many drawings and notes as I could, but to summarize, surgical precision and technical excellence is a must. You need to have the right instruments, whether it's the retracting double hooks or the right needle driver size. All of these contribute to the surgeon's ability to perform at their best. And preoperative planning starts with why. Why are we here? Which can then guide the necessary technique. I was continuously encouraged to look for the answer myself and not just accept what I'm told. I was told to always see the lumen, as well as to never stop striving for excellence, improving one's own technique and toolbox, becoming more thoughtful and less mechanical, and deepening your medical knowledge in whatever field that you were choosing to pursue in excellence. I also learned that high frequency ultrasound is an invaluable and a necessary skill to implement in my future career. While my Korean is quite elementary and juvenile in level, having that shared cultural and background knowledge really opened an opportunity to immerse myself more into the rotation, not just as an international visiting scholar, but kind of like opening a window as a Korean speaker. It enabled me to listen for little details like the size of sutures the professors were asking for when performing anastomoses, what settings to put their bovies and bipolars on. And in the clinic, understanding Korean gave me an insight into the patient-physician discussion that wouldn't necessarily be translated for the sake of teaching later on. And witnessing these encounters that were the same and yet very culturally different from my own institution back home in America was really important for me to see. And out of curiosity, I also rounded with the residents to see post-op patients, see how the lymphedema patients were wrapped, and to hear patients ask their questions and concerns while the residents answered with confident gentleness. On top of the wonderful clinical experience, I also had the chance to eat some wonderful Korean cuisine that never tastes as good in America as it does here in the motherland. And on top of that, I got to make some new friends, which really makes plastic surgery such a small, wonderful world. I really want to thank Professor Hong, Professor Pak, Professor Suh, Professor Kwon, and all the residents for your warm hospitality, willingness to intellectually engage, and openness to teach me over this course of the week. I really hope I get to come back and visit Asan Medical Center again and spend a longer time with Team A. Lastly, this is a photo of me and my hubeder back here at VCU. I know there's at least four of them interested in pursuing microsurgery, and I hope at least one of them can come visit Asan Plastic Surgery Department and have as wonderful an experience as I got to have. 감사합니다.